Welcome to the Honest Providers Podcast. This is Dalton with Honest Care Systems, and today I'm with my friend Dr. Michelle Francis.
Hey, thank you, Dalton, for having me here. I'm so excited to be here today.
Absolutely. I appreciate you taking time out of your busy day to talk with us about what honest and ethical care looks like to you and just a little bit about your journey. So really quick, I guess we're just going to get started. Who are you? Besides, we know you're Michelle, but who are you and what inspired you to get started on this journey in behavioral health and recovery work?
I am Michelle. How would I describe myself? I would say just a very down-to-earth person who found love in doing therapy. So I am a clinician. I've been a therapist for about 8 years now. I am licensed in Florida, Texas, and Massachusetts. So I'm able to provide care for individuals in all of those states. And I own a private practice, which is called Pinnacle Clinical Solutions. I see clients in person in the Orlando area, also Castleberry, but I also do telehealth for the entire state of Florida, Texas, and Massachusetts. So that's just a little bit about me. I'm a therapist, but I'm also very much a chill person.
I love it. And I also love the name. I know we said it earlier, but I'm going to say it again.
Thank you.
I'm going to put a jingle with it when we're done. What is something that maybe you've experienced or witnessed in being a behavioral health provider?
If I'm going to be quite honest, I think some providers from the past providers, typically they treat the symptoms and it's like, what's going on? We're trying to find symptom management as opposed to getting to the root cause of what's going on. So I didn't like that. That's something that's a big topic of conversation in our field. Are we symptoms fixers or are we trying to get to the cause? Because once you get to the cause, that's when you really find out what's going on. So for me, when I work with my clients, I definitely always try to go all the way back. Like, this didn't just start today. There's a reason why this is happening. So instead of just fixing the symptoms, let's try to find out like what's going on so that things can change as we move forward.
I love that. I mean, working with different clinics and clinicians, as well as my own family and own personal journey, seeing that same thing firsthand. It's easy to see a symptom and just make a lot of judgments or decisions based on that without truly getting to why it's occurring, especially. You have to do all the testing.
Exactly.
Awesome. So your approach and what makes it unique in how you do things and how does it help people in like a real lasting way?
I would say similar to my previous answer, like you want to look at the person as a whole, the entire system. So we have to think about their environment, their biology, and what's going on in their life right now. What are the current stressors? So I look at it from a holistic point of view, at least that's how I view it, so that I can help that individual in all areas. So let's say somebody comes to me and say they have anxiety, like I'm stressing over what's going on at work, but then that anxiety didn't just start at work. It's something more. There's a root cause to that. So it could go back generations. So that's what I do. I like to do a lot of digging. I do a lot of asking. I ask so many questions. Yeah. It might seem irrelevant, but it's not. There's a reason why I'm doing this. So I would say that makes me unique because I like to get really personal with my clients so that I can help them.
Absolutely. I love that you take not only a proactive approach, but also you seem to find joy in doing your job. And it's great to see someone who has that passion because, as you know, a lot of clinicians experience burnout or they're not taking care of themselves, so it makes it hard to take care of their clients or patients. So I love that you're doing a great job of preserving that energy and continuing to be able to put in to your clients. We talked about that would need to change. That's one thing that should change is people diagnosing based off some of the symptoms per se, right?
Yes.
What else do you think needs to change in the behavioral health industry as a whole that really could help improve things?
Honestly, cost, for being fair. Behavioral health services are not free. For the most part, there are certain communities or agencies that do offer low cost or free services. But if we look at the system as a whole, it's not free, and it shouldn't be. I'm not going to say it should be, but right. It needs to be more cost effective because as clinicians, yes, we go to school for a number of years to get our specialties, get our licenses. So we can't just do this work as a give back because we also have to make a living. But the cost, there has to be some way with legislation, community, the government, and us working together so that these access to care is accessible for people because there is a crisis out here. There's a mental health crisis. Every time you turn on the news, you hear this happened because of mental health or something else. And we're all just kind of watching it go by without doing anything. Therapy is technically a privilege because if you have insurance, if you can pay for it, that's a privilege, but it shouldn't be. A lot of people should be able to access this.
We talk to a lot of people who end up, especially patients who end up feeling like a number. They end up feeling like,
Yes.
what's your insurance, right? Or they don't feel like they're treated like a person. They feel like they're
Right.
getting treated as a number. So I agree with you there. And there's a lot of people that watch these videos online who may be dealing with this for the first time, or maybe they're a provider that's been in the industry for a while. What advice or message would you share with other providers or families that are trying to find someone like yourself who's willing to do work the right way and help people from really an honest, caring perspective?
Great question. I would say don't be scared to reach out for help. That's
Mhm.
number one. Similar to a prospective patient or a provider. With the patient, don't be scared to ask for help because there's a reason. Usually, when you want to start therapy, there's something in you saying, I need to go, but something is holding you back.
Right.
Don't be scared. Take that leap. Healing takes time, but not healing, that's worse than anything else. So just make that first step. And then for clinicians who want to get in the field and do this work, also nothing comes overnight. This is like 8+ years of school. So just one step at a time and you'll get there. So on both ends, you just have to take the first step and you'll get to where you want to be.
I love that. It's one of those things that, if you're trying to get help, you need to get help and find the right person
Yes.
that can best serve you and your needs, who can understand what you're going through and doesn't see you as essentially a number, but also
Another number.
for those who are, looking to get in the field, it's a climb, and it's a rewarding climb, provided you do it the right way with the right people. And I love that you speak to that, and that I know we've spoke previously that, you've worked with people you came up through that journey yourself, and you've also helped other people come through that same journey.
Yes.
And just that experience itself is just invaluable. So you've had a long journey. Obviously, you said this isn't an overnight thing, right?
No.
So looking back at your journey, what would you say that you're most proud of? So
Oh wow. I come from a culture that does not necessarily believe in therapy, if I'm being quite honest.
I hear that. I hear that a lot. I love it.
So you get it. So I'm Jamaican. So coming from that culture, love my culture, but a lot of people don't believe in therapy, but I knew that going to therapy was impactful. So me going through that, getting my own therapist, seeing how impactful that is, and then finding that passion to become one myself. So I'm most proud of always following my heart, following my dreams, doing what I think is best for me to the point where I am right now.
I love the energy, and I love hearing that you're proud of where you started and where you are now, and that you've been able to see that journey of people come from cultures or backgrounds, or just even immediate family sometimes, right? Who don't
Yes.
believe in therapy. And sometimes you have to break that mold and redefine your future, and then just that stereotype or stigma in general around you don't need help, suck it up, or
Exactly.
pray about it's a big one we hear. And and although those things can help, there's still that aspect of it where you're still gonna have to break a mold. You're still gonna have to, get help.
Absolutely.
I think taking all those things, figuring out what works for you and what doesn't work for you, but still pursuing the help you need is critical in moving forward in life. So I do, again, appreciate you taking the time to hop on with me. I know you got a busy day ahead of you. Where would be a good place if someone wanted to find you online and connect with you? I know you're up in Castleberry, Florida, not too far from us here in Orlando. Where would they be able to find you online?
So my website is pinnacleclinicalsolutions.com. That's the same handle for Facebook, same handle for Instagram, and my phone number is 954-479-9709. Reach out for a free consultation so that I can start helping you today.
Love that. Well, Michelle, again, I appreciate you taking the time to hop on with me and share your journey and just the impact you're doing with your patients, with other families, and just in the world. So the joy that you're bringing to the community it's a good thing. You're doing great things.
Awesome. Thank you so much for having me.
Awesome. We'll talk soon.